Hey guys, we're going to do a video about movements and muscles at the hip joint right now. And speaking of the hip joint, we can see it right there on the left hand side of your screen. Recall that the hip joint is a ball and socket joint. So as a ball and socket joint, it is going to be capable of a lot of movements, 3 planes of movement. And what we see in the bottom picture here, we see 2 hip movements. So there is flexion, where the hip angle is going to go from about 180 degrees to something less. And so that's flexion of the hip. And then if we go back, we even go farther back, that would be extension of the hip. So decreasing your hip angle is flexion, increasing your hip angle is extension. Now because the hip joint is a ball and socket joint, there are more movements that are capable. So another movement we can do, another pair of movements, are abduction and adduction. So abduction, taking the leg out, abducting it, stealing it away from the body. Adduction, adding it back in, adding the leg back in. So now bear in mind that flexion and extension are going to be in the sagittal plane, going forward and backward, and then abduction and adduction are in the frontal plane. Now also realize that abduction is going out, so your abductor muscles should be on the outside of the hip. Adduction is going in, so your adductors should be on the inside of the hip. Similarly, your flexor muscles will be in the front because flexion is towards the front. Extension muscles will be in the back because extension is towards the back. All right, at our hip joint, we can also do rotation. We can do medial and lateral rotation. Lateral where your toes turn out, medial where your toes turn in. Okay, let's look at some muscles. If we look in the abdominal cavity here, really in the pelvis, we're going to see some important muscles. We see this long muscle right here. We actually don't even see all of him. We see a lot of him. That long muscle right there is called the psoas. Psoas means loin, and it's called the psoas major. So as the psoas major, it is a hip flexor. There is a neighbor for it, and I'll do it on this side. I'll draw the neighbor. There's the neighbor right there. That neighbor to the psoas major is the iliacus. It's on the iliac bone, so it's the iliacus. These two guys are synergists. They are both hip flexors. Sometimes, because they're so close together and they work so much together, they are referred to collectively as the iliopsoas. All right, that's a good model. Let's keep going. We can see some more interesting things here. You can see some more flexors of the hip, in fact. One of the hip flexors we can see is this guy right here. This whole long ribbon of a muscle right there, extending from the outside front of the hip to the inside of the knee. That whole muscle right there, it is called, it's not called it is called the Sartorius. The Sartorius. The Sartorius is going to do a couple different things. It is a hip flexor, but it also is going to flex the knee, and it is going to laterally rotate the hip as well. The Sartor of Sartorius means tailor, because back in the day, this is the classic way a tailor would sit as he mended clothes. And you can see in this drawing, the hip and knee are both flexed. Not this drawing, this picture. The hip and knee are both flexed, and the thigh is laterally rotated. Okay, let's keep on keeping on here. If we look at this model, same model that we had before, we're going to add a muscle to it, and then we're going to look at this lady's muscles. She's very muscular. Now, if I look, I had the Sartorius from earlier. There is another neighboring muscle. Remember, neighbors often do the similar jobs. This neighboring muscle right here, with the tendinous insertion running down the middle, this guy is called the rectus femoris. He's straight-ish. That's why he's the rectus, and he's in that femoral region on that femur, so he's the rectus femoris. This guy is also a flexor of the hip. Now, we're going to meet him later, too, because he is an extender of the knee. Okay, if we turn our attention to the lady right here, and by the way, even though we're doing lower body muscles right now, you should totally pause this and name all of her visible upper body muscles. Like I can see her delts, her pecs, her lats. I can see her traps, her abs, her obliques, her biceps brachii, triceps brachii, her brachioradialis. You should find all those things. All right, check her out. We can totally see her Sartorius right there. She has an awesome Sartorius. We can also see her rectus femoris. There is her right rectus femoris, and there is her left rectus femoris. Fantastic. Okay, let's clear all of this stuff. Move on to another picture. On this left-hand picture here, let's start by pointing out the ones we've done already. Check out that Sartorius right there. Beautiful Sartorius. Check out that rectus femoris right there. All that, yep, all that is the rectus femoris. And now there is another muscle we're going to meet right now, in fact, that is another flexor of the hip. It is this guy right here. Notice how rectus femoris, Sartorius, and this new one are all together. This new one, I might type this one out. This new one is called the tensor, because it's going to tense something. Well, what's it going to tense? It's going to tense some connective tissue. Come on. So it's called the tensor fasciae, and it's going to connect some connective tissue on the side of the leg. So it's called the tensor fasciae lati, for side, like the word lateral. And that's it right there. So it is a neighbor to our rectus femoris. It is a neighbor to our Sartorius. And by the way, we can also see this guy right here. Whoops, come on. There we go. There we go. Right there. That thing right there, by the way, is the iliopsoas right there. Don't forget about that little iliopsoas. We can see him right there. Now, if we rotate this model, I can still see the rectus femoris right there, but I can also see the tensor fasciae lati from the side, right there, right there. Okay, if I look at this lady here, I can see her tensor fasciae lati. She has a really awesome tensor fasciae lati right there. By the way, you should pause this. You should find her triceps brachii. You should find her deltoid. You should find her trapezius. You should find her brachioradialis, her biceps brachii. I can see all those things on her. Okay, one more thing. Notice that the tensor fasciae lati is on the side and in the front. So because it's in the front, it's going to be a flexor. Because it's on the side, we're going to come back and talk about it later when we're doing abductors. Remember, abductors pull your thigh, your leg out to the side. All right, that'll do it for our first video about the lower limb. I'll see you guys next time for the next one. Bye-bye.